I am Rebecca Lamoureux, as mentioned, and I'm a medical physicist from the University of New Mexico. And I serve as a member of the AAPM Committee on Medical Physicists and Educators. And I'm thrilled to have the opportunity to share with you this topic to see. So why is this presentation called 2.0? Well, in 2023, we launched our first Educators Roadshow presentation for chapters. And I'm curious how many maybe have been a part of that presentation. One, someone else, no, you were there. But yeah, so essentially this is the second round of that. And we introduced topics then such as Bloom's taxonomy, backward design, and active learning strategies for 15 of the regional chapters, which was excellent to be able to reach so much of the United States. Today's presentation will present on new educational content. So our learning objectives are going to be explaining active learning strategies in medical education or medical physics education, describe the use of virtual reality in medical physics education, as well as identify some AAPM sponsored resources for medical physicists and educators such as this. So who are medical physics educators? As medical physicists, we teach at many levels and in many settings. How many here today, by show of hands, would identify as an educator? Awesome, great, perfect. So more formalized teaching arenas could be thought of as graduate or residency programs, but many are involved in medical resident teaching and supervision, or mentoring of trainees in medical health professions such as therapist or technologist. Formally and informally, we're guiding our more junior colleagues, leading in-service trainings, and also providing peer education at conferences such as this one. Even students and trainees, while you're being taught in new areas, are also in a dual role of teaching their existing expertise to others. So basically, everyone in our community is an educator in some form. Nope, I didn't. Sorry. Okay, so right now we're going to cover some active learning techniques and implementation. And this has been shown to increase levels of engagement and retention for learners. While many people are interested in applying best practice, it can be helpful to have examples of how to incorporate these strategies. In this segment, I'll share an example of how you can teach TG51 for learners for non-physicists, such as radiation therapists or medical residents. This, as we see here, would be a typical approach for teaching the topic. First, you assign the students to read the report, and you review what was in the report and explain the material in a lecture. Maybe homework problems follow after that. The classic approach can be then supported using active learning strategies by developing thoughtful questions to gauge student understanding. Prior to the lecture, you can provide demonstration of how it works. You can identify areas that you know are common misconceptions to frame learning activities, such as a jigsaw, peer discussion, and or concept mapping. So first could be developing questions to assess the student's understanding after their reading. Examples could be, can you measure dose directly? Why or why not? What equipment is required for TG51 and why? What is the expected range of values for each of the correction factors for TG51? Next could be an in-class activity like a jigsaw. How many in here have ever experienced a jigsaw teaching approach, either as a teacher or learner? Kind of new to everyone. All right, great. So not that crazy, but it's definitely an active activity that would help your learners to kind of socialize and also just synthesize what they've learned in more of a group setting. So here it was identified that students often have difficulty with the correction factors in the TG51 formalism. As a known area for misconceptions, you want to address these head-on as an instructor. To do this, you can arrange large Post-it notes in the room to represent each of the factors. And you split the class into smaller groups for each of those factors to discuss everything that they know about that factor and write it on the Post-it note. After a certain amount of time, or once there is saturation of ideas being discussed, then the group members will rotate to the next station, with one person staying behind for continuity and to describe what the last group had discussed. And then they add additional ideas and notes to that Post-it note. This will continue until most of the students are able to rotate through the stations for discussion. And then at the end, the students will describe what they understand, and then the instructor, yourself, can help facilitate the summary of what things are accurate and important and highlight misconceptions and gaps in students' understanding. Very different approach to learning this. After understanding the fundamentals, you can demonstrate how the work is actually performed to connect the theory with reality. This tangible next step is assumed by those who practice, but it provides a window into making deeper connections for novices, making the science come to life with its application. The final step could be asking learners to create a concept map of their understanding. Concept maps are visual representations of how you mentally group terms together. It makes one's conceptual framework for a topic apparent for both the learner and the instructor. On the left are different examples from the internet that can be in different forms, which can be more artistic or more like block diagrams. And on the right are some terms that could be provided for the learners specific to teaching 50. And these are some examples of actual concept maps from students. You can see different groupings and arrows with labels for those different students. What is important is reviewing what concepts do not have a home and being able to discuss where important terms and concepts should belong to help students develop from novices to experts in their thinking and be able to think like a medical physicist. So you'll note that none of the activities presented need to be for a grade. It's more of a formative assessment to yourself to know where the students are at and to help the students reflect. So that's really the value of these opportunities. So the next topic we'll talk about is virtual reality in medical physics education. This is an exciting area for exploration and integration, and it's really something that's starting to become more apparent as an effective tool in today's environment. While older versions of VR may have not had the best graphics, were prototype versions that were not user-friendly, the modern virtual reality products are incredibly realistic. Show of hands who got to see it in the corner over there. Yeah, very realistic. You're basically immersed into different reality virtually. Yes, so they can simulate complex clinical procedures that are rare or resource intensive, and this allows learners to practice and understand in a safe environment. In a recent review study, VR has been shown to enhance learning outcomes and engagement in radiation disease education. So there are many different terms that are related in this area. And just as a brief introduction, extended reality is a term that's applied to all immersive experiences. Augmented reality is allowing for static information to be integrated into a real environment. So Pokemon Go, that's a good example. This is an example of observing how a product would look in your home. You can do in Google, or placing a model of a linear accelerator on your table. This is an example of mixed reality where the user interacts with responsive virtual elements that are integrated into the real environment. So here is an example of a patient undergoing surgery with their MR image overlaid onto the patient. What we will focus on is virtual reality, where the user is immersed in an interactive, digitally generated environment. In this example, a learner is interacting in the virtual environment with imaging or treatment devices. VR has already been proven to be valuable in a number of areas related to medical physics. This is not a comprehensive overview, but just highlighting some of the work that's already been done in these areas. For radiation safety, virtual environments have been developed to visualize situations and simulate doses received by personnel during the simulation. These immersive simulations allow trainees to practice complex procedures in a risk-free setting, improving hazard recognition and reinforcing best practices for minimizing exposure without the constraints of physical resources or real-world risks. Immersive environments have been developed with high fidelity for medical imaging scenarios for training. These platforms enable realistic practice of imaging workflows and decision-making, enhancing technical proficiency and reducing errors without exposing patients to unnecessary risks or radiation. Anatomy can be explored without cadavers and imaging contouring. So this is what we were demoing over in the corner. And also segmentation can be extended from this 2D concept into that 3D visualization. This approach enhances spatial understanding of anatomical structures, as well as supports more accurate treatment planning by providing interactive volumetric views of patient-specific data. Brachytherapy can come to life using simulations for HDR and LDR treatments and simulate emergency scenarios. These interactive tools allow clinicians to practice source placement, dose delivery, and emergency protocols in a controlled environment, improving preparedness and patient safety without the risk. This is an example of a brachytherapy simulation that was presented by Dr. Nusrat and team at the 2025 Innovations in Medical Physics Education Symposium. You can see the initial modeling to simulate their brachytherapy suite to be realistic and gamifying the process with changing the needle color based on the accuracy of the placement. So if it's in the correct place, it's green. You can see as he's going in, it might turn red if he's not exactly in the right spot. It makes it very This is similar. So the videos show examples of what the VR interface looks like for the user inside the simulation. As soon as you put the goggles on, the rest of the world disappears. And this is what your reality becomes. This is clinical room and you're doing this process.
Does the physician have tactile feedback?
There is some vibration that comes with the controller, so maybe a little bit, not as much as you normally would, to be sure. So that's a great point. Yeah.
All right, thank you.
Yeah, you're very welcome. VR has been effective in building confidence with linear accelerators by understanding not only mechanical use and patient setup, but by providing visualization of dose in an interactive environment. This immersive approach reinforces safe operation and treatment accuracy by allowing learners to explore beam geometry dose distribution, and workflow without a linear accelerator. So this would be excellent. And again, having somewhere where you want to train someone on a LINAC, but maybe you don't have access to that. On the training of our workforce, it has also been shown to benefit patient experience by providing a new means of education for the patients we serve to understand their care. Interactive visualization tools help patients grasp complex procedures and treatment plans, fostering informed decision-making and reducing anxiety through clear, personalized explanations. In a 2024 review, it was shown that of the studies that investigated the use of VR for medical physics education, many are now beyond the prototype stage and have been evaluated in full implementation. The students completed so far have primarily been conducted in traditional learner populations, such as students and residents. And this provides great promise for adaptation and implementation of VR in the future for training and education of our workforce. That's showing that 60% more students and the rest of the distribution there. Okay, so to pivot a little bit, now we'll talk about the resources that come through our committee. Sometimes being an educator can feel a little bit isolating or overwhelming with other responsibilities. No one really teaches you how to teach, they just say, go do it. So you're not alone in that. And the conclusion of this presentation, again, will present those additional resources for you. To provide a brief background, this presentation is sponsored by the APM Committee on Medical Physicists as Educators. Our committee has 3 specific charges, which are listed here. Number 1 is to develop and deposit resources and provide support for programs that would assist medical physicists in becoming better teachers of medical physics. The second is to review models and techniques for clinical instruction in medical physics, compile best practices, and provide mechanisms for evaluation and dissemination of instructional techniques. And third is to interface with APM, ACGME, and other educational organizations to learn from their teaching experience. The committee currently has a subcommittee that's dedicated to the development of teaching and mentoring workshops and providing monthly resources to medical physicists as educators. Our key areas of focus are to develop resources, disseminate new ideas, review best practices, provide education for educators. And I'll briefly share the efforts in each one of these different quadrants here. So the first, for many years, we had an APM wiki site with wonderful resources. It was very difficult to access. This has recently been rehomed to the APM Educators Resource Guide to be more accessible to members. These include resources in cognitive science, teaching models and practices, assessment and presentations, including those from Innovations finalists and past workshops. The Education Council is now supporting medical physics education resources to be shared on the Living Physics portal, and APM members can now upload and access resources for medical physicists in this portal. There is much literature on education, but we thought that having a reference in the context of medical physics education was needed to relate these strategies to our field. So APM Report 366 was published in the fall of 2025, presenting the best practices in teaching and mentoring medical physics. Topics include classroom instruction, active learning, assessment, and clinical education. We encourage you to review this as a resource for your education and as a helpful reference for you and your colleagues. Publishing educational initiatives are valued by the Journal of Applied Clinical Medical Physics, or JACMP. The submission categories have been recently revised, so just at the beginning of this year, 2026. So article types related to education can be found as research articles in education, technical notes for sharing teaching tools, or approaches to training, or case reports. So please consider this as an option for sharing your scholarly work in medical physics education. The Arthur Boyer Innovation in Medical Physics Education Symposium showcases innovative educational initiatives for the physics education of physicists, physicians, ancillary personnel, and the public. Abstracts are reviewed each year with the top 6 abstracts invited to present at the APM annual meeting and to compete for the award and a $2,000 prize. So each year the presentations are extremely inspiring. The 2025 winner was Natalia Kovalchuk, I'm sure I said that wrong, PhD et al. And they presented on supporting for radiotherapy in Ukraine, help Ukraine group activities, and the importance of international collaboration. Very, very good presentation. Top presentations have also been highlighted in encore webinar presentations that can be found on the APM webinar library. So if you missed it, you can go back and watch it. And we will be hosting this again at Vancouver this year. So our newest subcommittee is focused on bringing educational materials to medical physicists through monthly virtual sessions. AAPM members can learn more about the monthly topic and engage in discussion with others to grow as educators together. If you want to be opted in to these sessions, go ahead and use the QR code there to go ahead and sign up for that. Let's do it out here. Oh, that's very good. Lucky go. We're almost there. So far, there have been many topics presented and discussed. I encourage you to check this out as a resource if you're interested in learning more. All of the content from past sessions are available for asynchronous learning or hosting your own institutional discussion. The next round of topics will be launched again soon. Several workshops have been hosted as specialty meetings focusing on improving teaching and mentoring. We hosted 2023 virtual specialty meeting where topics were presented on best practice in teaching, both the theory and application in medical physics. And there were small group interactive discussions to discuss the applications in the classroom. We are proposing an in-person specialty meeting in 2027. So keep an eye out for this special event. Hopefully sign up. And our final example of helping provide information to medical physicists is our traveling roadshow presentation, which you're currently watching. Again, we started this in 2023 and we're currently doing 2.0. So in summary, to help your learners, you can apply active learning strategies to enhance your teaching and consider exploring the use of virtual reality and use all of the references and additional helpful resources from the medical physics educators. So thank you to the committee members for their volunteer efforts and making this presentation and all the efforts to provide educational opportunities for our community. And thank you so much for your attention.
Any quick questions?
I'd like to see you at Arthur Boyer.
All right, our next speaker is Victor Lopez.